ECG. How does that sound? We'll get you fixed in no time, my darling. Okay. So I'm just gonna pop some hand sanitizer on. Alright. So how have you been feeling in yourself? Yeah. Oh, you poor thing. And how long has this been going on for? Yeah. And have you been able to keep any fluids or anything down? Yeah, right, okay. Okay. Alright, well, I'm just going to put a apron on, okay? And some gloves. And that just protects me and it protects you as well, alright? Okay. Can I get you a juice or anything like that? A water? No? Okay. So I'm just going to ask about how you're feeling right now, okay? Okay. So on a scale of 1 to 10, how are you feeling? 1 being amazing, 10 being absolutely awful. An 8, right, okay. And in the last 24 hours, how much have you had to eat? Okay, and in the last 24 hours, how much have you had to drink? Okay. Alright, no problem, my darling. Is it okay if I just have a touch of your face? You are feeling rather warm, aren't you? Okay, my darling. Alright. Okay. Okay. Can I have a feel of your throat? Yeah. Okay. Alright, my darling. You rest, okay? Chill. Just gonna put some gloves on. Okay. Okay, so what I'm going to do first, okay, is I'm just going to listen to your breathing. Okay. It might be a little bit cold, alright, but I'll try and warm it up as best as I can, but it will be cold, just so you don't jump. Okay. Wonderful. Alright then. If you just sit tall, okay, and just breathe in like you would. Well done. Yeah. Okay. Yeah, just take one deep breath in for me. And let it go. Okay, can you cough? Okay, and can you cough? Okay, I'm going to listen to the back now, alright? Okay, deep breath in for me. Hold it. And release. Just breathe normal for me. And other side. Okay. Can you take a deep breath in for me? Hold it. Now breathe out. Just breathe normal for me. Okay, just moving down a little bit. Breathe normal for me. Okay, now I'm just going to move there. Now cough. Well done, my darling. You've done an amazing job. Yeah, you really did, yeah. I'm just going to jot some things down before I forget, because I've got a memory like a fishbowl. You have got a little bit of a wheeze going on, and a little bit of a crackle, but not much, alright? Yeah. Okay. Yeah. Do you smoke or vape? Right. Okay. Yeah. Alright then, no problem. Okay. Okay, so I've got a oxygen monitor. Okay, so I'm just going to put that on your finger like that. Alright, and it's just going to monitor the oxygen. Alright, I'm going to have a little look in your throat as well, just if you're having a crackly chest, just to see what's going on, if anything. Okay, the light might be a little bit bright. I've got this tongue presser. Okay, so can you open up for me? Thank you, and there we go. Alright, can you say ah for me? Yeah, that's it. Okay. Okay, and again, say ah for me. Amazing, you're doing so good. Alright. Perfect, amazing. Okay, alright, I'm just going to feel your throat and your glands, alright? Just going to have a little feel. Okay. Okay. Is there any discomfort there at all? Okay, what about when I press? What about here? Yeah, I've got a bit of a swelling going on. Yeah, I think you're starting with a sore throat. I think, yeah. Okay. Alright. Okay, I'm satisfied with that, okay. Okay, my darling, I'm just gonna check this temperature for you. There we go. Oh, it is quite high, isn't it? Yeah, okay. Okay, what I'm going to do is I'm going to give you some medicine, okay, to get that temperature down. Alright. Okay, my darling. There we go, open up for me. Thank you. There we go. Well done, well done. Yes, done that. Now I'm just going to check your eyes. Alright. I want you to look at my nose or just behind me. It is very bright. Can you see that? Yeah. Okay. Just look at my nose. Okay. Okay. Now can you follow the light? Alright, can you close your eyes? And how many times do you see the light shine across your eyes? How many times have you seen it? Okay, look at me, look at my nose. Okay. Okay, now can you follow the light for me? Okay. Follow the light for me. Okay. Do you see the light? Yep. Blink, 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 blink. Do you see the light? Do you see the light? Do you see the light? Okay. Okay. I'm just going to come a bit closer to you, okay? Okay. Blink, 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 blink. Okay. Okay. Okay, wonderful. All right. Tell me when you can see my fingers, okay? Okay. Wonderful. Good. 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 Tell me when you can't see my fingers anymore. Amazing. You're doing so well. Okay. Yep. Yep. Okay. Okay, well done. Okay. Okay. Is it okay if I come a little bit closer to you? Okay. I'm just going to feel your face. Okay, and I'm just going to press your face. I'm just going to see if the colour and the electricity bounces back. You know what I mean? I can't speak today. It's been a long day. Yeah, just relax for me. There's nothing at all that you need to do apart from tell me if anything I do hurts you or it feels like a really sharp shock, or if you get any tingling sensations. Apart from that, you don't need to do absolutely anything, my darling. Just let me do all the work. Okay. Any pressure? Now, what about when I click on your eyes? Is there any pressure, any feeling of soreness? What about when I press on your nose there? No? Okay. That's a good sign so far. What about around your ears? No? What about on your jaw? Good. Your cheeks? Your nose? Your eyebrows? Your temples? Your forehead? No? Amazing. It's busy out there, isn't it? It's always that busy. Okay, so we're going to play a little game. It's called Soft and Sharp. I love this game. Okay, now I want you to close your eyes. Close your eyes. Okay, and I'm just going to, this is, what does that feel like to you? Soft, yeah. And what does this feel like? Sharp, right? So when you feel soft and sharp, tell me soft and sharp, okay? Okay. Yep, close your eyes. Right, we're starting now. Soft, sharp, 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 soft, soft, sharp, sharp, soft, sharp, soft, soft. Try that one again. Sharp, soft, soft, sharp, sharp, soft, sharp. Try that one again. Soft, sharp, soft, sharp, soft, sharp, soft, 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 sharp, sharp, soft. That was sharp. Okay, you can open your eyes. You've done really well. Okay, so I'm going to test your smell now. Okay. So I have this, okay, and it smells a bit like, well, you would chew it. I'm going to let you try and smell it. So you would probably put it in your mouth to chew. Yeah. And then you would probably use it for, I don't know, maybe making your breath smell better. Bubblegum. Well done. Yes, it is. Perfect. Well done. Okay. Now we're going to move on to doing some facial movements. Okay, so give me a big smile. Okay, frown. Okay, eyebrows up. Well done. Puff your cheeks out. Okay, don't let me bust them. Don't let me bust them. Okay, now I want you to put your shoulders up. Don't let me push them down. Okay, now push my hands. Don't let me push your hands back. Okay, now I want you to put your hands out like this. And I'm going to squeeze them in. Push back. Okay, well done. Okay, push back. Push back. Push back. Are you feeling very weak? Yeah. Okay, okay. Okay, well, I want you to touch your nose and then touch my finger, okay? So touch your nose, touch my finger. 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 Okay. Touch your nose, touch my finger. Okay. Touch your nose, touch my finger. Okay, perfect. Oh, are you fine? sample from you, okay? So if you go and do that, and I'll make you a nice cup of tea. How does that sound? Okay, you go and do that for me and I'll go and make you a cup of tea. Perfect. There's your cup of tea, my darling. I'm just going to leave it just there for you. It's still quite warm. Did you do that urine sample? Oh, thank you so much, thank you. Right, I'm just going to do a few tests, okay? Yep. Okay, let's do that. I'm also just going to do a pregnancy test as well, alright, just to see. Okay, I'll let that settle for a second. We'll do these tests. Okay. Okay, I'm going to let that settle as well for a second. Okay. Oh, yeah, if I leave it there, would you put it in the bin for us? Thank you. Okay, I'm just going to take my gloves off and put some antiseptic on my hands. Oh, would you put that? Oh, thank you. Saves me taking it all back with me. Okay. I need to get myself some more antiseptic gel. Okay. Right, let's have a look at this pregnancy test, should we? Okay. Well, it came back negative. So that's really, really, really good, isn't it? Are you happy about that? Oh, good. That's good then. So I can put that in the bin as well. Alright. Sure you don't mind putting it in the bin? Okay. Right, let's have a look. So, yes, you are looking a bit dehydrated. Yeah. Okay, your iron's down a little bit as well. Alright, and yeah, okay, alright, no problem. Okay. Put a fresh pair of gloves on. Alright. So I'm going to do a quick ECG on you. Alright. How is your pain? Right, okay. Okay, you can have your cup of tea if you want your cup of tea. I've made it nice and sugary for you. Okay, so that's that. There's not that. And then there's no. And then, yeah. Okay. Yep. Yep. Oh, no. Give you some drops to get your iron back up a bit, okay? If you just open up for me. That's it. Just a few drops in your mouth. There we go. Well done. And the time is, yep. Okay. Have you been getting much sleep? Lovely. Right, okay. Alright, my darling, okay. And the pain from 0 to 10. Not pain. I'm absolutely no pain or 10 pain. Like agony. Okay. Okay, my darling. Okay. So I'm just going to have a little look in your ears, alright? That's it. Yeah, I'm just going to have a little feel just around there. So any hair when I do that. Okay. What about when I press? And at the back of your ear. What about there? Okay, perfect. And the same again. Okay. Pressing. One foot there. Okay. Press. And what about the back? Anything? No. Okay, marvellous. So no earache at all. Okay. Are you sure? Okay. Okay, and what about bad headaches? Do you get any headaches? Migraines or anything like that? Just a dull ache, okay. Okay. Do you mind if I feel your head? Okay. Yeah, just relax for me and I'm just gonna feel your head. Okay. So the hairline, is that fine? Yeah. And round by ears, that's fine, yeah. And here, okay. Okay, well, what about when I'm just gonna feel the size of your head, okay? Just tapping. Okay. Okay. I don't feel any bumps or anything like that, so that's really good. Okay, and your scalp looks absolutely fine. Okay, and the back of your head looks fine. Any pain or any pressure or anything here? Okay, perfect. Okay, and did that give you a headache or anything when I was touching your head and the back of your head and things? No. What about here? What about here? No. No. No, are you sure? Okay. You're doing amazing. I promise you really are. You're doing amazing. Okay. Have I done everything? No. I need to do an ECG, don't I? I'm just going to take this back off your finger now, okay? Let's have a look, see how you've been getting on. Okay. Alright. Okay, let's get this ECG on you. It's just a mini one, just to see how you're getting on. Okay. Okay. So I'm just going to stick it one right there like that. And then I'm just going to stick the other one just there like that. on now. Okay. While that's doing that, I have fetched you something. Okay, and these are to go in your water. They are water enhancers. So it's to get more nutrients in you, so you can't really keep anything down, okay? So this is what they look like. Okay, it's just a little one, and it activates with water. It tells you everything that you got to do. Alright, so I'm going to leave you the whole packet. Okay. Yeah, it gives you all the instructions, everything that you need to do right here. And I think I picked up, yes, black cherry. I think there was grape, apple or black cherry, so I picked you up the black cherry. Alright, so these are for you to keep. Just have one a day, okay? Perfect. Okay. Do you want me to... I don't know. Oh, you've got a hairbrush there. Do you want me to brush your hair a little bit while we're doing the ECG? Yeah. Is this your hairbrush, is it? Yeah. Okay. You close your eyes for me. And it'll make the ECG better. More you relaxed, more everything will feel so much better, my darling. Just relax, 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 relax. Relax for me. Relax. You haven't got to do anything right now. Just relax. Let all the worries of today just go. There you go. And I think that ECG is done now as well. Okay. Yep, I can take them back off you now. Well done. Thank you very much. And the other one. Amazing, thank you. So, yeah. I thought so. It's just telling me that you're absolutely exhausted. You really need some sleep. Come on, drink up. Drink that cup of tea. And again, drink up. Well, that's all my jobs and my tests all done now.